Welcome. EPractice HMS is a fully integrated electronic medical system that is designed for a seamless operation in any healthcare facility. So with EPractice HMS, it could run on a platform from a PC, a laptop, a mobile smartphone, or a tablet. And so it has the mobile capability to move in within the facility. It is designed in a modular to fit your OPD, which is the outpatient department, the IPD, which is the inpatient department operations in your hospital. We have it in modular format. We have the registration and records, medical records for that particular patient. We also have the clinical charting. We have the pharmacy. We have the billing and insurance, investigation, which is the lab and the imaging side. And then we have a total reporting system that could report on all these processes or departments. We also have optional modules such as OBGYN antenatal, and also virtual medical mission system, which is a modern day telemedicine that could be used from remote environment to be able to treat patients. These are optional modules. And then we have the medical document storage management, whereby we can host scanning your previous documents and attaching it to patient folder. All these practices you can see in EPractice HMS. So without much further ado, let me give you a sample of how it runs and how it could run in your organization. Here, for example, there is a login, an admin, a login of the admin of the system. You see down here that this admin is able to see web-based. This admin will be able to see all the everything about the hospital. The registration department, very simple, cleared out. The clinical, the billing, the pharmacy, the investigation, which is the imaging and the lab, and then the reporting system. Everything is right there for the admin to see. But then we also go further to have a strong security whereby you will be able to manage the users. The admin will be able to manage the users. For example, we have roles, departments. This is a provider. We give the provider access. For example, Dr. Alabi, for example, only has access to clinical side and so forth. And other members of the team will also have access to certain things. For example, this is the registration. John Ede only have access to registration department and no further actions. And that makes it in a modular format, autonomous format, whereby you will be able to customize who runs, how your system runs in your hospital. So for example, here in the clinical side, you will see that we have so much features, but we don't want to overwhelm the users with all the features we have. Here, for example, the doctors will go in and see who is on the schedule on that day, who is still being attended to, and then from here they can click to the encounter ID, which is a number that is given on every visit that a patient makes. For example, Yusuf Adedeji, when you click in here, this information displays everything about Yusuf Adedeji, the vital signs, the complaints, SOAP notes, progress notes, prescriptions, and all this we can define in a more descriptive way. But right now, I'm just trying to give you an overview of exactly what is going on. If you can see right here, you'll be able to have multiple visits, and then the doctor will be able to see this either with a tablet, a phone, or a desktop PC, a laptop. So all these are information, and we also have review of systems where doctors or people can actually add much information about that patient that is very, very detailed about knowing everything that is going on with that patient or the past histories to be captured. That is one example, and then we also have the billing side. The billing side has the same look. Yusuf Adedeji has some payments that he needs to do. You see it on the roll here. This is for the finance department or the billing department in your organization. We also have the the pharmacy, and these are the people who have received orders from the doctor to be able to have their requests dispensed. Here we have the investigation, the same thing. We see the investigation, these are the orders that have been placed by the doctor or by the provider. Right here, if we go deeper to investigation, we find out that we have internal and external for Yusuf Adedeji request. And then we also have reports, multiple reports. We have reports here for vital charting, medical research, medical statistical, advanced statistical. And this is a very, very powerful report whereby you can go and search on patients on particular OPD or IPD, what the provider is, the number, vaccinations, so do all kind of research that you want. All these are embedded in our system. So that is a nutshell of what we can offer or what we have, excluding the OBGYN, which is a separate module that treats patients, female patients that are coming in for pregnancy and other tests that are involving antenatal. Thank you.